Thank you for walking us through that. And I could imagine from microbiology to patents and intellectual property rights, and then teaching it, and now shifting and transitioning to a Master's of Science in Molecular Medicine at the University of South Florida. Tell us about that transition and that thought process.
Okay, so this part of my life was absolutely a change in my personal life as well as I came here after my marriage. So it was a transition in my personal life and my academic life as well. So, but I just have to talk about if I have to talk about my Masters of Medicine, how did I get in? Was a simple process that I had to take a GRE because I was an international student, and the score had to be greater than 300 or equal to 300. And I had to take a TOEFL, which had a score cutoff of greater than or equal to 100. And I got in, so I surely scored at least equal. So, and I got by that score, I got into Morsani College of Medicine in University of South Florida. That made me move from Texas to Tampa, while my husband was still working in Texas, and he was so adorable. He supported my whole journey and my move and long distance relationship at that point of time. Yeah, so that was kind of led me to an unpaid directed research opportunity where I assisted in Department of Bioinformatics. There was this project of immunogenetics research study which is going on with the aim of quantitatively measuring the electrostatic complementarity of immunoreceptors with mutant peptides, which were specific to the lung carcinoma in a patient. Okay, so we were basically, in a simple way, if I have to put it, we were looking for biomarkers or immunomarkers which showed us that why the lung cancer is worse or better, and is the chemotherapy or any immunotherapy working? Is any therapy working on the patient for the patient? And which is better, an immunotherapy or to identify or eventually put uh, the patient on immunotherapy by identifying that which immunoreceptor actually combines with the mutant peptide and decreases its effect of carcinogens. So basically, we had to investigate survival rates based on that by using the current electronic health record. Okay, so my biggest thing I learned from this program was have to access the electronic health record. What is electronic health? How to manipulate it and how to analyze it, and um, what is the impact of health data analytics or bioinformatics on the public health. So that kind of, and then the situation was that when the pandemic started, I had to move to Texas because the USF requested to evacuate the campus because of the pandemic, and at least the people who can go back home should go back home. And I came back to Texas. I lost my internship at Moffitt Cancer Research, and things changed for me. And I have this realization for within me that public health is something I want to move forward with. So I transferred from molecular medicine program to public health. Yeah, and that's how I ended up into Master in Public Health in University of Texas Health Science Center at Dallas.
Yeah, and walk us through that thought process a little bit. What about public health really drew you to wanna get that master's of public health?
Sure. So this program was, I would say, impeccably designed. It was a competitive program. It was a very hands-on and practically designed program for students, considering the current scenario which was going on in the world. So we had to do a couple of few practicums and take particular courses, the core courses, and graduate by performing a capstone presentation for a year-long capstone project. So I moved to Tyler, and it was in the middle of pandemic. I was super duper happy doing that because I was getting to do all these things which I always wanted to. And I was getting a scholarship there with an on-campus job as a graduate research assistant and a coordinator. So that's how I got into the position of a community, being a project coordinator and a graduate research assistant for a community academic partnership for substance abuse. And I met my mentor, Dr. Yordi, over there, and she uh, and in this project, I had to kind of establish and nurture the collaborative environment within the diverse team of specialists from various walks of public health and community health and even the community stakeholders. So, and various partnerships, uh, and even the administrative department uh, within the Department of University of Texas. So I had to create monthly and quarterly summaries, reports, and create insights to update the steering committee to make better decisions and see how the funding, the research work is going on in the direction. I the main and a very interesting skill updating from this position was I knew how to use the virtual suits. By that I mean the Microsoft suite, the Teams, Zoom, WebEx, etc. Because I got to organize a pan USA virtual CAPSA conference, which was kind of uh, containing all the industry experts and community stakeholders and bringing 100 participants overall together. Uh, so basically, I eventually uh, created the content from that moderating and uh, facilitating the event and the conference. And I transformed and evaluated the research findings. I actually helped, assisted. I gave a compelling graphics to the advisory meeting after that. I created a survey, a feedback survey, an evaluation survey, which actually helped us to see the final report for the grant. And so this gave me a skill of how to coordinate the project, how to liaise between the stakeholders and the partnerships. So that was also very pivotal. And then I did several internships slash practicum, which were kind of the first one was involved a telephonic interviews and surveys recruiting people, using the health record, and conducting a qualitative analysis from the collected data and present a statistical analysis and visualization in front of the panel, which was kind of, uh, I previously talked about that using health records for the benefit of observing and making better healthcare solutions